From the food we eat, the air we breathe, the land we dwell, to the health of our body and mind and the well-being of all things in the universe. Unlock the science with Chula Radio Plus.
Hello, I'm Lawan Jirasradet. Today we are going to unlock the science of death in Buddhism and palliative care. Death is a circumstance we have heard and seen perpetually in the media since 2020. And too many, they have witnessed it firsthand. When an infectious disease caused by novel coronavirus or COVID-19 loomed large into a pandemic. Fear and anxiety of dying and death have become collective experiences across the globe. It is this condition of sufferings, illness, physical decay, dying, and death, which propelled Prince Siddhartha Gautama, who was later known as the Buddha, to search for the true meaning of life. Hence, the beginning of Buddhism some 2,600 years ago in India. The teaching of the Buddha revolves around the fact that life is suffering and impermanent, and how to liberate oneself from such sufferings. It sees the cycle of life, birth, death, and rebirth as a universal truth. Buddhism is a religion with no God. It is rather a philosophy and practice of mind to be free from sufferings, where meditation has been introduced as one way to develop the mind. To expand on that, I will cite a statement from a Buddhist monk, the renowned Venerable Paisan Visalo, from the website visalo.org.
Buddhism believes that every human can cultivate their mind to be free from suffering, even though we all face aging, sickness, and death. Our minds need not to be painful from this if only we accept the reality with no refusal and no resistance. Acceptance is the most important factor for us to be free from suffering.
That is the voice of a radio producer. More than 2,000 years ago, Buddhist missionaries were dispatched from India to the east and southeast of Asia. Subsequently, Buddhism was propagated and established in Thailand. To date, over 90% of Thai population are identified as Buddhists. Venerable Paisan Visalo is an abbot of a forest temple in Chayabum province in the northeast of Thailand. He is vocal and progressive in applying Buddhist principles to facilitate social development as well as to tackle issues in modern-day living. In the 2000s, Phra Paisan Visaro raised an uneasy subject to most of us, death, and set up an educational project known as Facing Death Peacefully. Since then, he has been instrumental in creating end-of-life care networks of healthcare professionals, volunteers, monks, and communities to deal with spiritual elements in their healthcare practice. He believes that care for spiritual well-being is as important as physical well-being. As he wrote,
Even though the body and mind are closely related, when the body suffers, the mind does not necessarily have to suffer too. One can take care of one's mind such that it does not suffer along with one's body.
For final stage patients, whom nowadays are more preferably referred to as patients in palliative care, spiritual care can help them spend the rest of their time with positive mindset. It can supplement their physical well-being to a certain extent as well. Most of all, spiritual care helps prepare them to have a good death. World Health Organization or WHO defines palliative care as an approach that improves the quality of life of patients, both adults and children and their families, who are facing problems associated with life-threatening illness. In 2014, WHO announced the first global resolution on palliative care to improve access to this treatment as a core component of health systems. Thailand has adopted the resolution since. According to Buddhist perspective, good death is the condition of mind at the time of death, dying in peace, without fear or mental suffering. พระไพศาลวิสาโรจน์ said,
This was possible when one accepts one's own death and let go of everything, not attachment to anything or any person.
At Chulalongkorn University, a group of nurses have been working and researching on how to better take care of the spiritual well-being of patients with terminal cancer based on Buddhist principles. That team is known as Asian Wisdom Care Research Unit. The head of this research unit is Dr. Sureeporn, an associate professor of nursing. Cancer is the number one killer of Thai people, according to Ministry of Public Health. In fact, cancer is the leading cause of death worldwide in 2020, according to World Health Organization. With more than 40 years of nursing patients with chronic illness and those at the end stage of their life, Dr. Sureeporn, herself a rigorous Buddhist, has adopted Buddhism in her nursing care and research. Her aim is to find an alternative care for both the patients and healthcare professionals to allow them to better cope with the end of life stage. I talked to her about her works and this apparently uneasy topic. Dr. Sureeporn, the most relevant topic in your study is death acceptance. How do Thai patients in general perceive death? And do they have death fear and anxieties, or do they carry good attitudes about that because they are Buddhists?
In general, to many people, death is abstract, incomprehensible, intangible, and reluctant to talk about. Hence, thoughts about death may trigger anticipation, anxiety, and fear. Studies on death and dying have long focused on death anxiety and death fear. Studies have also shown that lack of death acceptance was one of the characteristics of bad death, less quality of life, and high suffering in palliative patients. In our research, we compare the results of death acceptance level among Buddhist cancer patients in Thailand and non-Buddhist cancer patients in other countries. We found that Thai Buddhist cancer patients had high level of death acceptance, while non-Buddhist cancer patients in other countries had moderate level of death acceptance. This may be because Buddhists consider death with peaceful and pure mind as a good death. Accepting death has been highlighted as an important attitude that can help patients in having a more peaceful death.
How can preparing and accepting reality as well as death help patients in palliative care and end-of-life care?
Similar to advanced care planning, process of acceptance and awareness of death are crucial for advanced care preparation. Therefore, patients and families need to be interactively informed by healthcare professionals. In addition, the process can promote high empathic caring situation among patients, family, and healthcare team. This acceptance is a dynamic process and usually not achieved all at once. However, people who have accepted death will not have the feeling of being lost when they know that they are going to die. They have a will to live and want to be conscious for their remaining life, and they tend to have peaceful deaths. However, people who cannot accept their coming death often feel suffering and are not well prepared for it. Their acceptance helps bring positive energy to their family and healthcare professionals as well.
Does the education of death acceptance help nurses and healthcare professionals to do their job better?
Yes, the education of death acceptance will be useful to enhance jobs of nurses and healthcare professionals because the word death is taboo. Most of the nurses or healthcare professionals might have difficulty to touch on death with patients. We have developed a tool called Buddhist death acceptance scale, so it will be an easier tool for nurses to assess patients' death acceptance. In my point of view, studies of death acceptance appear to be a good approach to help nurses understand how patients think from a positive viewpoint about their death and dying. Nurses should understand patients' attitude toward death before initiate any conversation aiming towards end-of-life caring activities.
From your experience as a nurse, are there different dying reaction or condition between patients who accept death and those who do not?
For my experience as palliative care nurse, I found that patients who were cared at Kamamong Temple, which used Buddhist-based, accept their death better than patients who were treated at General Hospital. From my observations that need to be studied further, patients who had accepted death might have mild symptoms, or in case they had severe symptoms, they could cope easier because they understood that everything in their life can cause sufferings and that everything can be destroyed. Awareness of these realities can reduce the degree of desire and attachment in their body. So they could face the last hour of suffering by themselves and they could pass away peacefully, sometimes with smile on their faces. Their family could also accept the process of patient's death and could have a normal process of loss and grief. However, people who could not accept their coming death often felt suffering with severe symptoms. At the near-death process, most of them were dependent on healthcare professionals and needs of high technology or aggressive treatment. They also had agitation, worry, and fear of death because they were not well prepared for it. Majority of patients who did not have death acceptance might pass away with suffering that can make their family feel sadder and harder to pass this loss.
We will hear more of her research after a short break.
You are listening to Unlock the Science on Chula Radio Plus.
The Asian Wisdom Care Research Unit of Dr. Sureeporn has found out that Buddhist principles help to improve quality of life and spirit of patients in the last stage of cancer. Consequently, in 2020, they developed a therapy program based on Buddhist Daisika, or threefold trainings in higher level of morality, mentality, and wisdom. In addition, they help come out with a test to evaluate mental capacity of patients with terminal illness. This psychometric property assessment is known as Buddhist Death Acceptance Scale, or BDAS in abbreviation, which is a set of questionnaires assessing how well a patient is mentally prepared for his or her death. This assessment is based on the Buddhist philosophy of Tailakkana, or the three characteristics of existence, which are impermanence, suffering, and non-self. I will ask Dr. Sureeporn to expand on this. One of the outcomes from your research is a test to assess death acceptance among patients. Can you tell us more about it?
Buddhist Death Acceptance Scale, or BDAS, is a neo-holistic perspective of death acceptance rooted in Buddhist philosophy. It is more than an attitude, more than a cognitive process. It encompasses behavior and embodies expression of death. There are two sets of 13 items which are formatted as statements about patient's thoughts, verbalization, and action toward their days.
Which question did patient feel confident and comfortable to respond?
Patients feel confident and comfortable to respond item of BDAS about. I accept the result of the treatment because I think nothing can be certain in this life, followed by I am not afraid of death because death is natural matter for all people. This reflects the Buddhist perspective that everything is impermanent. Even the self or soul. Patients who accept that death will likely prepare for it.
Which one did patient feel difficult or uncomfortable to respond?
Patients feel uncomfortable to respond to item about. I think that my family can overcome their grief after I die. In the process of their acceptance, the family and patients may be at different stages. The other one was, I request not to use any aggressive treatment to prolong my life. This item may indicate that cancer patients wanted to continue with treatment as long as they could because of their fear. They believe that they should continue life as long as possible, or because they want to follow physicians' recommendations for treatment. Any of these reasons could affect their willingness to say enough at some point and make a request to their physicians to stop aggressive treatment.
How can the death acceptance assessment tool be utilized?
This instrument is based on Buddhist perspective and is a reliable and valid tool for nurses and healthcare professionals to assess their acceptance among Thai Buddhists with cancer. Almost 95% of Thai population are Buddhist, and thus the instrument is valid for the vast majority of the population.
After nurses make assessment for death acceptance, what types of intervention can they initiate to help patients other than routine nursing intervention? Can you give some example?
The nurses can use Buddhist activities for helping the patients to grow their awareness of this, such as meditation, chanting, or use the basic Buddhist principle intervention that we developed called Trisikha program. In this program, we decided activity related to Buddhist concepts. There are the activities that training about morality of conduct for good moral behavior, followed by the activity that training about a peaceful mind and great quality of the mind. And the last is activity that training about living happily with recognition of the world and real life. The examples of some activities are sharing the truth, sharing good memory, make a wish with flower arranging, or right living view. This program might be useful for patients to understanding about their acceptance. Anyway, any new nursing intervention need to be tested before use.
Can this Buddhist acceptance death scale be applied for non-Buddhist or non-religious patients?
Even though this scale was developed from Buddhist perspectives, its items are non-religious specific assessment tool, which can be applied for non-Buddhist or non-religious patients, but it needs to be tested for use. We plan to study the use of BDAS in non-Buddhist groups, either in Thailand or other countries, such as United States or Italy.
Your research aim is also to reach out to Buddhist patients in other countries. What are your plans?
Since the BDAS is philosophically based on Buddhism, it may be modified to measure cross-cultural death acceptance across Buddhist groups and population outside Thailand. We have already translated BDAS into Vietnamese version and test for quality with reliability and psychometric tests in Vietnam. So it can be used among Vietnamese patients with cancer. At the moment, we have been collaborating with Faculty of Nursing Chiba University in Japan to do research on death acceptance in various groups among both countries. So we are working on translation of BDAS into Japanese version. We also started the communication with University of Hong Kong to do a joint research and plan to translate the BDAS into Chinese version.
What do you plan to study next?
We plan to use BDAS to study in other groups, such as patients with chronic illness and healthy elderly. After we know the factors that influence death acceptance of this group, we will develop nursing interventions to improve the death acceptance. Another research aspect that we will study is how to develop Buddhist-based intervention programs to help nurses who work in palliative care to promote their self-care attitude and behaviors, because most of them often face with compassion fatigue from prolonging care for palliative patients.
Dr. Sureeporn, who has long experience in nursing patients facing death, and who has applied Buddhist philosophy in her nursing care, to unlock the science that Thai cancer patients who are Buddhist tend to accept their coming death better than non-Buddhist cancer patients in other countries. She said the reason is probably that Buddhists see death with a peaceful mind as a good death. In other words, one who can accept his or her coming death well will tend to die peacefully. This could also help their family members to better deal with the loss of their loved ones, as they see no suffering in the death of their parting members. On the other hand, Dr. Sureeporn said, those who cannot accept their coming death tend to develop agony and will need intensive care and treatment. This head of Asian Wisdom Care Research Unit also said that the Buddhist Death Acceptance Scale, which is a set of questionnaires assessing how well a patient is mentally prepared for his or her death developed by her team, could be applied across religions and cultures. The test has been applied with cancer patients in Vietnam. The team now plans to apply it to Japanese and Chinese people. The assessment will help doctors and nurses to better understand the mental state of the patients, so they could develop a care to suit the need of their remaining days. Advanced medical technologies have prolonged our lives and have kept us in our comfort zones to the extent that we somehow may have an illusion. Perhaps lives never end. Yet, the Buddha said, life is impermanent, and death is a natural course of life. Thank you, Associate Professor Dr. Sureeporn Thanasilp from Faculty of Nursing, Chulalongkorn University. Unlock the Science also feel grateful to information on Facing Death Peacefully project by พระไพศาล วิสาโล published on the website visalo.org. I also would like to thank Dr. เฉลิมชัย ยอดมาลัย Senior Editor of Thai Language Daily, แนวหน้า for his extra voiceover in this episode. Thank you for listening. See you again next Saturday. Have a nice day.
Unlock the Science is edited and produced by Sinfa Tunsarawut with Lawan Jirasuradet as the program host and co-producer.